So again, a pleasant good afternoon to everyone. So I have already presented to you our schedule of activities for today for the asynchronous, or rather for the synchronous and asynchronous session. But the asynchronous session was set to be your 1 hour health break. And I'd like to present to you the learning outcomes for today. Our learning outcomes for today is the continuation of the discussion of topics that are related to the drugs during pregnancy and lactation. And the last time we have already started with the discussion of the drugs for pain control during labor. And topics were also discussed. Self-assessment exercise had been also administered as part of our self evaluation. If you have learned effectively the topics that we have discussed in the past sessions. Now, later on, as we go on with our discussion, the platform or the Zoom are open for any queries. As much as many questions, I would be more motivated and inspired, so that that's very evident that we are interacting with each other, and it boosts your critical and thinking and curiosity as well. So what do you expect uh, in our discussion for today? We have been updated with some of the trends and issues that it's very important for the nurses to be competent. And nowadays, there's a major concern, if for example, that in our education, when it comes to the flexible learning system, we are aware of the situations that uh, the practical side of the development of the psychomotor skills are restricted in a way that because we are complying or in compliance rather with uh, the CHED Department of Health Joint Memorandum Circular. However, the limited face-to-face could be the key for us to learn these concepts as well. But in spite of these limitations, our students and the College of Nursing is not considering this as a gap, but rather we consider it as a challenge on how we will deliver the topics to you creatively and innovatively in a way that you may expect to meet the learning outcomes of our topic for today. So we have already discussed pertaining to the drugs for pain control during labor. We have differentiated analgesia, sedation, and anesthesia. So all of these drugs could be could be intended for pain control. However, it may vary specifically on the mental and physical responsiveness, because if we considered analgesia, there is insensibility of pain, but it may not affect the consciousness and the physical responsiveness of the individuals. So we have examples by which uh, analgesics that sometimes it may cause drowsiness, but still uh, it may cause pain relief, but it may not cause the total loss of consciousness. It's just only drowsiness. So if ever the patient receives opioid analgesics, narcotic analgesics, as what I've told you before, that the pain motor response are blocked, which is directed from the central nervous system, such as the brain. However, the drowsiness itself is because of the result of the direct blocking in the pain receptors. However, this is only just temporary, but the person can still maximize physical responsiveness. So even it's considered as narcotic analgesic. But the difference between the sedation, the control of pain will be diminished. Rather, there will be a control of pain. Pain severity could be diminished. However, there could be a slight change in the consciousness level. So from alert, the person may be somehow lethargic or drowsy, and there could be limitations in the physical responsiveness. So that is sedation, so sedate. So once we consider anesthesia, the anesthesia is there's loss of painful sensation, but the consideration here is with or without loss of consciousness. For general anesthesia, probably there is a loss of consciousness. For the spinal anesthesia, probably there is without loss of consciousness because of the effect of the anesthesia is from waist below. But so it's from the waist up. The patient can still be aware of the and conscious of his or her environment. So this is the difference. These are the difference, and we have already considered and the discussion of sedative tranquilizers, because eventually there are some situations that it aggravate the anxiety level when the patient is in labor. So why there's a need to have sedative tranquilizers? So unlike na lang sir, di ba, we could facilitate na lang administration of sedative drug. Why need tranquilizers? Because there are some individuals who cannot there could be a decrease in the pain threshold or tolerance, and even minor pains, for them they perceive it as major pain, which may affect specifically their anxiety level and how they cope with the pain experience. So that's why there could be a possibility that aside from the pain management, we're also considering anxiety to keep them calm, and considering the tranquilizer. So we have considered this secobarbital. So this is for purpose of the decreasing the anxiety during the latent phase. So the latent phase is the first phase of labor. So the pentobarbital is different from the secobarbital kasi the secobarbital could have the long acting, but the pentobarbital could be short acting. If we're considering category D, we have considered the positive evidence that there are adverse reactions to the fetus. And number 3, sedative tranquilizer that we may consider is promethazine. So promethazine is a combination of antihistamine and antiemetic. So we have defined emesis as vomiting. So if it is antiemetic, it's anti-vomiting. So one that the nurse must take into consideration when you are about to give promethazine is if it is given intramuscular, it must be via Z-track method. And the Z-track method, its purpose is to prevent severe tissue damage. This is considered as category C. So we have mentioned that in the category C, the drug itself has adverse reactions, has evidence of adverse reactions to the fetus, but no adequate studies. We have also identified hydroxyzine. So, di ba, pag promethazine, hydroxyzine, yan. So, kung promethazine, hydroxyzine, so combination, antihistamine, antiemetics. However, aside from that action of antihistamine and antiemetic, it has also the anxiolytic effect. And usually, this is used prior to the operation and post-operative. Class, remember, when you encounter adjunct drug, adjunct supportive drug. Yan. So we have already classified this in the pharmacotherapeutics, if you can still remember that. Now we will proceed to the next. The next is all about narcotic agonists. So if we say narcotic agonists, these are already drugs to manage mild to severe pain already. Now in this consideration, if we say narcotic agonist, from the term itself, narcotic. Okay. So the drug itself, again, just the same as narcotic analgesics. Pag if we say narcotic agonist, these are the classification of drugs that is under the pain control, which has a higher effect of pain relief. So it is also directed to the central nervous system. So one is we have the fentanyl citrate. If you can remember the time that we are discussing the buccal, di ba, the fentanyl is usually for pain relief for cancer. So yun yung for the oral, but buccal rather yung administration. But if we say fentanyl citrate, usually it could give a mild to moderate sedation during labor. Usually, fentanyl citrate is contraindicated with severe asthma. Why? Usually, pag mga narcotic agonist na ito, since direct yan sa brain, uh, part of the brain, there is part of the brain that controls the respiration of every individual. So we have the medulla oblongata. So that's why if ever there will be sedation, it slows down yung neurotransmitters. Kasi ini-slow down mo eh. Tapos yung yung mismong nerve impulse, you are slowing also the response kasi nga the sedation itself slows electrical impulses that delays motor pain response. So question sir, why is it contraindicated with severe asthma? Kasi eventually pag anytime nag-cause to ng toxic effect and at the same time the person has severe asthma, it may further cause constriction of the bronchi. Why? Kasi di ba nga as what I've told you, there could be respiratory suppression kasi nga most this sedative drugs may have direct effect to the brain and it slows down its response. So kung ang medulla oblongata may need to further respond to the respiratory system, because of the sedative effect, slow yung response niya. Eh paano if there will be a severe asthma attack of the client? So it may also delay the response to open up the airway passages. So pwedeng mag-cause ito ng respiratory arrest. So yan pong tatandaan natin. Fentanyl citrate, mild to moderate sedation, pain relief during labor. Now, let us proceed to the morphine sulfate. Morphine sulfate are very common drugs for pain relief ng higher level na hindi na this could not be managed anymore by pain relievers. So morphine sulfate are considered as opioid. So pag sinabi naman natin na opioid, this already has a direct effect to the central nervous system. However, class opiate and opioid analgesics or narcotic agonists are regulated drugs. If you say regulated drugs, this cannot be purchased and be available over the counter. So I have emphasized to you before in our discussions that if there are regulated drugs such as the opioid analgesics or opiates, this is certainly and must be only prescribed by the physicians or anesthesiologists with S2 license. The S2 license is the one that will be the basis of the pharmacist to release a drug to the person who's purchasing it. So pag walang S2 license and signature by the authorized S2 licensed physicians, you will not be allowed. Ano ba yung, what are the mga most common drugs that are radio dispensed na it will not allow over the counter. So since regulated siya, yung mga anxiolytic drugs, yan hindi pwede. Mga drugs that will facilitate the stability of the mental health, yan. Those are drugs that may need S2. So let's proceed to the number 2, the morphine sulfate. This is considered as category C, same as fentanyl citrate. So if you say pass category C, there is an evidence, rather there is a report or adverse reaction to the fetus but no sufficient studies. So this is usually kung if fentanyl citrate is for mild to moderate. Pag moderate to severe, usually morphine yan. So remember that ha, pagka when the person is in labor and the pain is not anymore tolerable from mild to moderate, so sedation could be given. Pero still, since category C and may affect the fetal well-being, the nurse is responsible to check the fetal heart tone because this may also affect the fetal activities. And if ever, sabi ko nga po sa inyo, if this may reach to its toxicity level from the perspective of the mother, this may cause the possibility of affecting the respiratory rate. So similar also, that may also have an effect to the fetus. And how can you distinguish and determine that the babies or the fetus is already experiencing the respiratory distress? So checking the heart rate via Doppler or via fetoscope. So on the morphine sulfate, this is on a higher level of management for moderate to severe pain. So usually morphine sulfate are given preoperative medication to supplement anesthesia. So if we say supplement anesthesia, so this may support specifically on the perspective of control of pain, that before or prior to the operation, the person is already prepared for the operation and manage the pain, and it will just, and once it will subside its effect, it will continue by the anesthesia, because even in the induction of anesthesia there could be a possibility that for example, general anesthesia prior to operation, it may need intubation, so sedation could be necessary. So for example, another example, if it will introduce some of the the anesthesia that may require specific insertion of needles. So this may also, the sedation could be also a support or an adjunct, so that to manage the pain of the patients who will undergo the operation. So the problem with the morphine sulfate is that of just the same with the magnesium sulfate. When it reaches its toxicity level, the problem is it may cause a problem with respiratory suppression. So that's why even with the magnesium sulfate, if it reaches the respiratory suppression, the antidote is naloxone hydrochloride, if you can still remember that. The naloxone hydrochloride or Narcan. So if it causes cardiac suppression of the morphine sulfate, the drug that could be given would be epinephrine. So class, remember this, because once you will be assigned in the operating room, I've been assigned in the operating room. These are the drugs that are usually administered by the anesthesiologist, and the nurse has a major responsibility in preparation of the patient prior to its administration, because the vital signs is very significant. It lies on the role of the nurse if it will continue the induction of the anesthesia or hold. So because it may cause nga the possibility na anytime if there will be a problem when it comes to the administration or induction of anesthesia, it may compromise the respiratory and the cardiac status of the client. Now, another is there are some situations that if those sedative tranquilizers are not working, if narcotic agonists are not working, there could be the third one, which is mixed narcotic agonist antagonist. So usually this is mixed kasi di ba nga when we considered opioid direct to the central nervous system, it may affect the fetal well-being. But there's still drugs na ang category niya when it comes to pregnancy risk categories could be safer compared to the mentioned sedative tranquilizer and the narcotic agonist. So ito po, usually this is for the relief of the moderate to severe pain. Butorphanol tartarate, but the category is C. So kung category is C, again, let's put it in mind that there's a problem or possible adverse reactions that may happen to the fetus. So again, responsibility as emphasized. So this is used in pregnancies for 37 weeks with no fetal distress. Remember ha, kaya if ever prior to administration of butorphanol tartarate, if it is above 37 weeks but there is fetal distress, nurses decide not to administer it. Or on the other hand, vice versa, if it is below 37 weeks and it has fetal distress, then again hold. Any of those categories or criteria that will cause the holding of the administration of the drug must be or must be alerted by the nurses. Now, nalbuphine hydrochloride. Okay, class. This is the usual drug that I have encountered when I was assigned in the delivery room, because if you will notice, from the sedative tranquilizers to the narcotic agonist to the mixed narcotic agonist and antagonist, the only drug when it comes to the analgesia and sedation, nalbuphine is the category B. So it's on the close as a higher level of safety, but even though there's no evidence of the sufficient and adequate studies on this. So pertaining to nalbuphine hydrochloride, the brand name is Nubain. These are considered as opioid agonists and antagonists. So any of the drugs that may be given to the client, the category B is the one that has less risk for the fetus. However, you must not again be complacent. Okay, it's category B. I will not anymore monitor the fetal heart rate. Hindi pa rin. It must continue. It must continue the monitoring every now and then because two aspects that you need to consider: the maternal and the fetal well-being. So if you are already considering administration of these drugs, then always take into consideration the safety of both. Specifically for those for the fetus, the mother can verbalize can you can gather subjective statements, but for the fetus it really lies on your skills and competencies to identify if the fetus is in distress or at risk already. So now let's have some self-assessment exercises which are connected to the topics also that we discussed before. I would rather it will be more interactive. A majority of you will participate. So there is a question. Let's start with the first self-assessment exercise. A patient with severe preeclampsia is on magnesium sulfate. The laboratory report, excuse me, the laboratory report shows a magnesium sulfate level of 7 milliequivalent per liter. Which of these is the most appropriate initial intervention? So let's analyze the question. Severe preeclampsia, the client's magnesium sulfate, the serum level of magnesium sulfate is 7 milliequivalent per liter. Now, if we're considering severe preeclampsia, can I ask what is our reference for blood pressure for severe preeclampsia? What is our reference of the blood pressure? Above what?
160 over 110.
Very good. 160 over 110. Do we have seizure already in the severe preeclampsia? Do we have seizure? Grand mal seizure?
Wala po.
Very good, because every time that it will consider the seizure, it will always na classified as eclampsia. Now, magnesium sulfate, what is the therapeutic level of magnesium sulfate? If you can still remember.
4 to 7.
So if it is 7 milliequivalent per liter, is it normal? Is it within the normal level? Is it within the therapeutic level?
Yes po.
Yes. O sige. So na-analyze nyo na yung question. So we have here the question, which of these is the most appropriate initial intervention based from this question? So we have continue to monitor the patient because this level is therapeutic. Next, we have contact. Ayan, the dogs are here. Please allow them to answer. Contact the healthcare provider and report the level. Next, we have prepare to administer 1 gram of calcium gluconate, which is the antidote. And we have turn the patient on her left side and administer 10 liters of oxygen via nasal cannula. So I think I have seen a raised hand. Mr. Reg Dominic, what is your answer? What is your answer? What is your answer?
Hello po, rinig na po ako?
Yes po.
A po, to continue to monitor the patient because of the therapeutic po.
Okay, let us reveal the answer. So the answer is letter A. Let them participate, ha? So the answer, you're correct, Mr. Sabader, Mr. Reg, to continue to monitor the patient because this level is therapeutic, because the 7 milliequivalent per liter is normal within the therapeutic level. Now, contact the health provider may not be necessary. Prepare to administer 1 gram of calcium gluconate may not be necessary because it does not reach naman the toxic level. Di ba the toxic level, that may reach to the respiratory suppression is almost 10 up. And we have for the cardiac suppression will be 20 up. Okay. For a while. Okay, let us continue. Stop the war. Let's promote peace. Okay? Okay. Let us continue. So thank you very much for that correct answer. Next question. Next question is, the nurse assessing a patient in preterm labor who is receiving magnesium sulfate. What is the finding of most concern? So let's have the choices. Letter G. Letter G is drowsiness. Next, we have feeling of warmth. Next is loss of patellar reflexes. And letter D, positive clonus plus positive 2 bilaterally. So I think the one who raised hand is Miss Tanghal.
Letter C po, loss of patellar lip reflexes po.
Okay. So actually, your answer is correct. Why? Because di ba we have emphasized in the administration of prior to the administration of magnesium sulfate, the client must be assessed with deep tendon reflexes. The letter G or drowsiness could be a side effect. The feeling of warmth could be side effect because the magnesium sulfate po class could be, it may cause warmth once it flows with the blood vessel. The positive clonus, positive 2 bilateral is a normal response. So as this is also reflexes. So most common is we have the loss of patellar reflexes, which find most concern because we are aware that the loss of patellar reflex may be risk for the possibility it still be administered to toxicity level and may affect, it may cause rather the what we call paralysis. Next question. Next question is, the patient has been receiving magnesium sulfate IV for 24 hours to treat severe preeclampsia for a while. Okay. So to treat severe preeclampsia, on assessment, the nurse finds temperature. The nurse finds temperature of 37.3, pulse of 88, respirations of 14 at 14, blood pressure of 138/76, 21 patellar reflexes, and negative ankle clonus. What is the priority nursing intervention? So let's see. Obtain a stat ibig sabihin immediate magnesium sulfate level. Letter B, discontinue magnesium sulfate. Letter C, contact the healthcare provider. And letter D, continue to monitor the patient. So let us analyze the question. Magnesium sulfate for 24 hours, severe preeclampsia. So we have to consider a level of above 160/110, a difference or twice that we have 4 hours interval that the patient may have this level. The temperature is 37.3, pulse is 88, respiration at 14, not in respiratory distress, blood pressure of 138/76, and 21 patellar reflexes. Since it has mentioned that the client is on severe preeclampsia, it seems that the blood pressure is stabilized already. So the 21 patellar reflexes are very evident and normal, and at least we must take into consideration negative ankle clonus. So which of the priority nursing intervention must be considered? Response? Students?
Letter D po.
Letter B po.
So I think you're letter B or D?
Boy po.
Boy, okay, ganito. Try to analyze. The 37.3, is it normal temperature? Is it a
Hindi
normal
po.
temperature?
Slightly, ano po.
Oo, pero still not the febrile, di ba? 88, is this a normal pulse?
Yes po.
Yeah. Respiration of 14. Not on respiratory distress kasi if 14 in respiratory distress is different. Blood pressure 138/76. Di ba ang 138/76 is almost pre-hypertension na ito, di ba? From the discussion that we have. Kasi di ba ang 120 below 120/80 is the normal, pag above 120/80 it's considered as pre-hypertension. However, the 76 below 80, the 138 is only higher. So pre-hypertensive lang siya. So hindi pa rin siya nagko-fall sa severe pre-eclampsia simply because it's 160/110. So there's patellar reflexes and negative clonus. So with your answers, let us analyze. The client may just continue the monitor. Rather, the nurse must only continue to monitor the patient because all of the findings from vital signs from the reflexes are normal. Okay. Next po. Next question. A young adolescent gravida 1 para 0 is admitted to labor and delivery with preterm labor at 29 weeks gestation. Which nursing intervention should the nurse include? Select all that apply, ha? Select all that apply. Administration of antenatal glucocorticoids. So this is probably steroids. Letter B, liver function test. Bed rest on the left lateral position. Administration of bolus intravenous fluids. Administration of tocolytics. So we are familiar with tocolytics, right? This is to prevent the uterine contraction. And administration of anti-hypertensive drugs. So, Reg, Dominic, do you want to try? Select
Yes
all
po,
that
Doc.
apply. Okay, sure.
Ay, din po. Ano
Sure,
po?
sure.
Administration of tocolytics po.
Okay, that's one.
Mm,
It could be
ano-
any of the any,
Yes
pwedeng
po.
dalawa lang yan, pwedeng tatlo, but the one that you may consider because there are questions in the international board examinations that there are many choices and you will choose the one that only applies. Oh, you may continue, Reg.
Tsaka po yung administration of antenatal glucocorticoids.
Glucocorticoids. Okay, let us analyze yung administration of antenatal glucocorticoids kasi ang purpose natin, di ba? 29 weeks gestation, then at the same time already labor and delivery kasi the term is admitted to labor and delivery with preterm labor na siya on 29 weeks gestation. Probably what you have considered, why you have considered the administration of the glucocorticoids is for the increasing the surfactant, right, for the fetus if ever there will be a premature delivery. Yan. So you have considered tocolytics, so very obviously we need to control the uterine contraction, which is eventually it's a preterm labor. So maybe we could also ask others po. Ms. Tanghal, would you want to try also? Would you
Ano
like to
po?
try? Yeah, would you like to try?
Opo. Sagot ko po is A,
Okay.
B,
Aha.
yung sagot.
It's letter A and
A, C, D, and E po. Yung
A,
apat po na
A, C, D, and E. Okay. Sige. We will ask also the others. Any other you wish to try? Miss Prestosa? Katrina?
Yung letter C po, yung bed rest po. On
Okay,
left
that's
lateral
one.
position po.
Okay. So, do you want to add pa? Since
Tapos
select
po
all that
yung-
apply.
Apa. Tapos po yung administration of bolus intravenous fluids po.
Okay.
Yun lang po din.
Yun lang. Sige.
Apa.
Let us reveal the answers. Hoping I may hear also answers from the others Kasi remember, this is another approach when it comes to presentation of questions in the board exam. So tingnan natin kung ano mga responses natin. So first, we consider the administration of antenatal glucocorticoids for the situations like for the situations wherein uh, to protect the fetus and to stimulate surfactants. Next, if we will reveal the other answers, bed rest, di ba? Sabi ko sa inyo, every time that there will be preterm labor, always an advice is bed rest. Usually nga ano if you wish to complete the response, complete bed rest without bathroom privileges pa nga the point of why we encourage to have left lateral position is to facilitate circulation. So will there be other? Okay. The other is administration of bolus intravenous fluid, because eventually this is for provision of hydration. So another is okay, next. Next is administration of tocolytics is significant. Actually, this is the one that all of you may agree, because this is the purpose is to prevent the contraction. So these are the ones, or these are the answers that applies to the situation. Liver function test may not be necessary. Administration of antihypertensive may not be necessary because the patient is in the situation there's no revealed blood pressure to justify administration of antihypertensive. Just for a while. Okay. Nako, let us continue. They are very much active when it comes to their responses. The dogs are telling me to finish earlier. Okay, anyway. So let us now proceed with anesthesia. So this is the last topic that is related to the pain control. Usually for the anesthesia, there is loss of painful sensation, but take into consideration with or without loss of consciousness. Usually when we will connect this to pregnancy, there are two types of pain that are basically identified. When it will improve or it will progress the labor, as what I have mentioned unto you, it will cause every time that there will be uterine muscle contraction, it goes also with the association of effacement of the cervix, the thinning of the cervix. And this will cause basically the stretching of the fibers, the muscle fibers, that also cause tension to the nerves. which eventually respond to the motor response of pain. So when we talk about the pain that are being experienced by the pregnant mothers at the time that it caused the labor, uterine contractions, and the stretching of the cervix when it comes to when it experiences the effacement upon its dilation, that is visceral pain. But once the baby is about to deliver and it causes the stretching of the vagina and the perineum, that is somatic pain. So clear yun ha, if the pain is related to the stretch of the sympathetic fibers of the uterine muscle and the cervical lining, that is visceral pain. When it talks about the stretching of the vagina and the perineum, the pressure on the presenting part is by the somatic pain. So let us now discuss what are the difference between the regional anesthesia. That's why if we say regional anesthesia, we are talking about only on the specific area. So usually regional anesthesias it achieves yung pain nito during labor and delivery without loss of consciousness. I just want to ask students, why do we need to manage accordingly pain management that will not cause loss of consciousness? Why do we need to manage pain without the loss of consciousness of the mother? Anyone? Anyone? Why? Why kaya?
Try lang po.
Sure, Miss Ipin.
Siguro
Very
po
much welcome.
Kaya po hindi pwede mawala ng consciousness yung mother during labor po kasi tendency rin po pagka diba nanganganak po tapos biglang nawala. Paano po mapupush yung bata? Or may lalabas yung
Exactly.
bata?
You're correct. Your answer is definitely correct because the bearing down, right, is very important. It must be continuous. Once the mother may need to do bearing down is when there will be a peak of the uterine muscle contraction, and at the same time it must continue within 10 seconds. So for example, the nurse is in the abdominal area, and if there is tenderness in the abdominal area, that is a proof of uterine muscle contraction. That's the time that the mother will be instructed to bear down for 10 seconds. 1, 2, mother, bear down, ire, 3, 4, 5, 6, 7, 8, 9, 10, then relax. Why do we need to achieve 10 seconds? It's because there could be a possibility that if it may not reach the 10 seconds, the tendency is there will be no continuity in the extrauterine in the delivery of the baby, and chances the baby goes back and forth, and if it goes back and forth, there could be a tendency that it may affect the head portion of the baby. That's why if you will notice, there are some situations that there is what we call, are you aware of if it causes the pressure on the head of the baby, it causes yung nakikita nyo yung parang cone head, and because of the pressure itself, kasi very soft pa ito, but eventually naman it will normalize, pero the pressure itself may risk the baby. Ang tawag doon is caput succedanum. So that's why we need to take into consideration that the mother must be cooperative. Kaya if the mother may not do the proper bearing down, it may affect the baby's head. Although it may normalize, but the risk of putting pressure to it is another concern. Okay? So bear this in mind, the mother lang will do the bearing down when there is an active contraction. If there is no contraction, don't let the mother bear down because she needs to reserve energy, which is very essential during delivery. So we also discussed the difference between local anesthetics and regional blocks. For local anesthetics, usually the local anesthetics are used when we wish to have episiotomy. So if we say Do you know what episiotomy is? This is usually in the normal spontaneous vaginal delivery. What is episiotomy?
Yung
Yes?
episiotomy po, yung parang pagkat po ng bahagya dun sa perineal area ng babae po para po
Yeah. Kasi
makalabas yung bata.
the point kasi that we will have the kasi pag otomy is opening eh. So we will extend the opening kasi pag nag-cause ng pressure yan, tapos nag-cause ng overstretching dun sa perineal area, pwedeng mag-tear yung ano eh. Pwedeng mag-cause ng tearing yung mag-tear yung tissues. Tapos pag nag-tear yung tissues, it's very hard to do episiotomy or repair because yung tearing down of tissues may not be equal. Kaya that's why when it will create the episiotomy, it will be more manageable to facilitate the episiotomy or the repair. So that's the point or purpose. But not all may need episiotomy. But the fact that this is to avoid tissue tearing of tissues or perineal tissues, episiotomy are created. So once we do the episiotomy, since kung ang patient is normal spontaneous vaginal delivery, sedation lang ang binibigay for control of pain. If painless spinal anesthesia, then she may not feel the episiotomy. Pero for individuals who are having the normal spontaneous vaginal delivery and sedation lang po ang in-administer, we must give local anesthesia. So it will have the lidocaine be administered in the perineal area, perineal muscle, and then it will cut for the episiotomy. If we talk about regional block, so from the term itself, block. So for regional blocks, epidural and spinal anesthesia, usually the anesthetic effect is usually from waist down. Yan and it is administered in the spinal area. Pero careful din very risky din kasi yung pag-administer via the spinal area kasi once you introduce the needle, it must be really sterile. Why? When we will assist the a patient on spinal anesthesia, the position must be left lateral knee chest, so that to facilitate the exposure of the back, the opening of the spine, so that when the needle is inserted, it will hit the area, the space itself. Ang risk doon kasi when the needle hit a wrong nerve, yan, paralysis could be. Second, if the needle is contaminated, you are introducing infection, and very much that if it passed through yung infection sa spinal area, this may affect the the spinal cord and at the same time yung central nervous system. So major yung effect niya, major function ang effect niya. So yun po ang tinatawag nating local anesthesia and regional block. So I have a question in the chat box. Gaano po katagal usually umi-effect ang regional block? Okay, ganito po 'yan. Ang regional block or usually ang spinal anesthesia will last for 2 to 4 hours. 2 to 4 hours yung effect. Kaya imagine ninyo na pag yung mother is not cooperative tapos almost 2 hours na hindi nagko-continue yung pag-deliver ng baby. So, ayan, pag nagre-risk na yung baby mo kasi matatandaan mo yun na if the mother is not cooperative tapos magsasubside na yung effect ng spinal anesthesia. Other than that, remember, it may also have an effect to the fetus. Pag yung mother mo umabot na ng almost 2 to 4 hours that she did not deliver her baby, posible na yan emergency cesarean section. Pero as much as possible, try to encourage the mother, instruct the mother prior to the delivery pa lang, ine-educate na natin sila of the importance of bearing down. So when it comes to ang patient mo after delivery, for example, the delivery we had the deliveries after 1 hour, so there will be 2 hours of monitoring. The patient will be flat on bed. Then the soonest possible after 4 hours, you will encourage the client to be in ambulation. Meaning, after 4 hours, the patient may sit on bed na, may dangle feet for purposes of ambulation. Kasi you must not consider the client flat on bed for the whole 24 hours after the delivery. This may cause a possibility na it may delay the recovery and the ambulation. So usually it goes through that time frame. So usually there are situations na ang regional anesthesia ay contraindicated. So even though sasabihin na ng mother, okay, doc, sabi you will mention the anesthesiologist, I want painless delivery. So you will be given spinal anesthesia. So if you will be given spinal anesthesia, there are contraindications. So ano yung contraindications? If you are the severe gestational hypertension, contraindicated po ang regional anesthesia. It may aggravate. So ano yung pwedeng aggravation doon? Kasi pag gestational hypertension, there is high blood pressure, tapos when you will introduce the spinal anesthesia, baka mag-lead yan eventually into eclampsia. Dangerous when you're about to introduce the spinal anesthesia, tapos nag-seizure yung pasyente, nag-reach into eclampsia. Dangerous yun. Why? It may cause possible sepsis or possibility na pwedeng mag-lead yan na yung once you have already inserted the needle tapos nag-cause ng seizure yung pasyente, there could be injury or damage to the spinal cord. So very risky. So may possibility of the possibility of the paralysis. Coagulation disorder. So anything related to the blood clotting and decrease platelet. In short, if there are bleeding tendencies po, contraindicated. Why? Kasi you will introduce needle eh. Once you introduce the needle, it passes through the tissues. You are creating a damage to the tissue eh. Once you insert the needle eh. Tapos if it will cause continuous bleeding yon, there could be a possibility na pwedeng mag-lead into the bleeding. Second, it could have a chances of it may lead to clotting na pwedeng mag-cause ng obstruction to the insertion site. So that clot may cause a possibility na mag-travel siya doon sa spinal area and may cause the obstruction at mag-lead pa yan into possibility of either infection or possibility of the obstruction of the circulation. So another is contraindication if there is generalized sepsis. If we say sepsis, this is severe infection. Lalo na if the infection are close to the needle site. So hindi. Saan ba yan in insert? So siyempre it's at the back. Tapos di ba you will position the patient to the left lateral tapos knee chest position. Tapos if there is an infection on the site, even though the needle is sterile, it may cause the possibility of giving an avenue for this microorganism to enter kasi you will create a portal of entry. So these are contraindicated for regional anesthesias. So now these are the common anesthesias that are being used in obstetrics. So remember, 'di ba yung mga cane? Yan, anesthetics, 'di ba yung mga cane? So ang chlorprocaine are usually used sa mga lumbar epidural block. So lumbar epidural block is regional. Okay. Category C. So remember, it may still have an effect on the fetus. So the nurse's responsibility is to check the fetal wellness or well-being. Tetracaine, this is used for spinal anesthesia. Kaya that's why, ma'am, you will ask your anesthesiologist, what po ang means po natin for the anesthesia po for painless? Epidural po ba tayo or spinal? So bear in mind, if you will be in the delivery room, mabilis ka dapat, lalo na pag mga emergency delivery na. We will do spinal anesthesia. Pasok na, tetracaine. Okay. Okay, nurse will do epidural. Have the chlorprocaine. So these are the type of anesthesia which intended on these situations. Next po, lidocaine injectable. Ang lidocaine injectable po, plus 'di ba, usually ang lidocaine is given intramuscularly. Okay? So usually ang lidocaine injectable is necessary lang if ever needed to manage heart rate. Kasi class, ang effect ng lidocaine pag binigay mo intramuscularly, local anesthesia. Pero ang lidocaine, pag in-inject mo intravenously, ang effect niyan sa heart, kino-correct niyan ang heart rhythm. So it's usually given on that perspective. Pero ang lidocaine injectable, ang usually inuuna yan, 'di ba sabi natin pag epidural at saka spinal anesthesia. Ang una munang uunahin diyan is magbibigay muna ng lidocaine. So 'di ba yung area na yon ng ma-anesthetize. Kasi for example, normal spontaneous vaginal delivery, gusto ko po ng I want painless. So for the pregnant mother not to feel yung pain once the needle is inserted, mag-introduce muna yan ng lidocaine. So i-anesthetize muna yung area ng wherein you will introduce the epidural or the spinal anesthesia. Then the next is either the epidural or the spinal anesthesia. The bupivacaine naman po ay usually you will prepare this if the client is intended na for cesarean section. Ayan ha. So for cesarean delivery na yan, bupivacaine na yan, category C. Usually it's not recommended. Medyo may studies dito eh. Not recommended kasi of the reports of cardiac arrest. So careful tayo. So that's why what will be your responsibility? For example, there's no drug and that's the available drug. Sabi ng anesthesiologist, this is the drug that will be administered. Please prepare it. Kaya usually if you will assist the anesthesiologist, usually the anesthesiologist the one who's preparing it nga kasi very risky because of the chances to have the cardiac arrest. But if the specialization of nurses will be promoted here in the Philippines and we will have the nurse anesthetists, I think you may have the what you call this, you will have a training that is related to this. So these are the anesthetic used in anesthesia. Okay, now let us now consider naman on the situation, kanina, preterm labor, we use tocolytics. Now naman, how about sir, if hindi naman mag-cause ng uterine contractility? Sometimes we have induced yung labor, pero as much as possible hindi dapat eh. Pero ini-initiate pa naman ito if ever hindi nagwo-work yung progress when it comes to the labor. So hindi nagpo-progress siya. Ibig sabihin it doesn't reach yung paces na expected na it must undergo. So usually uterotropic drugs are the ones that will enhance uterine contractility. Another is when there will be uterine atony. Yung uterine atony, for example, after delivery, it is expected that the uterine muscle must be firm. This is one that you need to monitor because once it is firm and relaxed, it may cause bleeding. At when the uterine muscle is not firm and not contracted, that is what we call uterine atony. Pag nag-uterine atony yan, this may cause the possibility of bleeding at pwedeng mag-cause ng hypovolemia or hypovolemic shock sa client at may lead to possible cardiac arrest din yan. So the usual drug that I have encountered, eto very significant yan, oxytocin. So from the term itself, from the hormone itself, oxytocin, an oxytocin agent, this will cause the uterine contraction. This is used to induce labor during pregnancy. Induce if it will not be progressive yung labor. This is to control postpartum hemorrhage if there will be relaxation of the uterine muscles. And this is to prevent uterine atony, yung continuous relaxation of the uterine muscle after delivery. If there will be no oxytocin, the usual drug that are given is methylirgonovin maleate. The brand name of this is Metergine. So ang concern naman natin dito is the same as yung purpose ng oxytocin. However, ang purpose naman natin dito is prevention and treatment na of postpartum hemorrhage. For example, if there's already bleeding, Metergine will be given. So pwedeng eventually after na yung ibang mga obstetrician, once the mother delivered already, to prevent uterine atony, magbibigay ng either oxytocin or the Metergine. Pero yung iba naman, if it is spontaneously, yung response naman ng na firm yung uterine muscles at no signs of bleeding, so the methylyl gonobin maleate or the oxytocin may not be necessary. So another is prevention and treatment of subinvolution and post-abortion hemorrhage. Pag sinabi natin subinvolution and post-abortion hemorrhage, usually when the client experience miscarriage, abortion, so the client will undergo dilatation and curettage. Okay, yung dilatation and curettage in colloquial RASPA, it will remove all the clots, the blood that are inside the uterine walls and cavity, so that pwedeng kasi yun ang mag-cause ng either infection or either that the clotting itself may affect the circulation. So usually this is the one being given. So usually contraindicated ito again, contraindicated ang Metergine pag magi-induce ng labor. Wag ito. If the purpose is magi-induce ng labor, oxytocin. Remember that, nurses, if it will induce labor, it's more on oxytocin, not with this methylgernobin maleate or Metergine. It may have the same purpose of preventing the uterine atony and postpartum hemorrhage, pero ito ay hindi for induced labor. Yon yung isa sa mga basic considerations dito. Okay. So actually, the next topic that we may consider are the discussions of the cardiovascular drugs, but I think I may end up to those drugs kasi supposedly we are about to start na the cardiovascular drugs. But moreover, this topic may be discussed na actually on this will be intended na for discussion on 22 and 24 already because the final exam will be next week. So let's start with this. Actually, I have already the videos that are intended for you to watch so that it may not cause a pressure to you in our synchronous session. However, probably I may stop here na, so that as I promise with all of you, that you deserve a health break. And I have already covered those topics that will be part of the midterm examination. So I'll stop the recording.